Story 1. My aunt had health insurance. Then things went south and she had to go to a nursing home. They partially covered the first 100 days of her stay, but what happened afterward was not something anyone should have to experience. After the first 100 days, the insurer stopped covering her stay, and she had to pay out of pocket $11,000 per month for subpar care. Medicaid will not start until she has less than $2,000 to her name. You cannot simply give away your money to family members. They look back 5 years to prevent that. She died a year later, practically penniless. Story 2. Before my oldest daughter was born, I chose the hospital for her delivery after verifying that they accepted our insurance and that we were in network. Somehow the delivery doctor was not in network and we were hit with a $40,000 bill. After months of arguing with the insurance company and the hospital, I told the hospital to go pound sand and changed my phone number. I had checked repeatedly throughout the process to avoid being stuck with a large bill. I have not heard from them in well over a decade. Story 3. How about my current one? $600 for a 30-day supply of one medication. Story 4. I was 23 when I broke my ankle and went to the emergency room. The emergency room doctor said, "Walk on it as much as you can tolerate," and being 23 and thinking I was invincible. That night, I tried as hard as I could to put weight on it and heard a pop. From that point on, the swelling got worse for 3 months. The orthopedist would not see me and kept sending me back to the emergency room. 6 months later, I finally had the surgery I should have had at the beginning, but by that point, the bone had healed incorrectly. That surgery was botched. I suffered nerve damage, and they did not correct the misaligned bone. I was in terrible pain and lost my job and my insurance. I was very persistent, refusing to give up on finding work and exercising diligently to stay in shape. Unfortunately, the exercise made my ankle impingement worse, and the obsession with finding a job made me depressed. I developed complex regional pain syndrome, a condition in which my ankle and foot were severely swollen, red, hot, and excruciatingly painful even from wearing a sock. It was 2010. There were very few job opportunities even if I could have worked. They prescribed gabapentin, Lyrica, cortisone injections, and antidepressants. Nothing helped. Surgeons would not touch my foot because of the swelling and my lack of insurance. Eventually, I had so much pain that I could not sleep properly. I became extremely depressed when I realized my pain and my limp might be permanent. My husband had to drop out of school because I was unable to earn money. We had no health insurance and had to move back in with my mother. Doctors then began to insist I was in pain because of depression. I saw a therapist and a psychiatrist, but both were frustrated with my lack of progress because the pain was never addressed. Each time I went to that hospital, the doctors would not discuss my ankle and redirected the conversation to my mental health. They thought I was crazy. They called me treatment resistant and said I had a somatic disorder. When I talked about my goals, going to graduate school and having a child, they condescendingly suggested that might be impossible for me because I was mentally ill. I did not qualify for disability benefits, so I could not even get food assistance. 6 years passed and I finally got health insurance again. I made an appointment at another hospital system. The doctor there took an X-ray, saw the piece of bone protruding in the wrong direction, and performed surgery to shave it down. He drilled small holes in the bone to create scar tissue that would act like cartilage in the ankle joint. I improved within 2 weeks. That fall I ran in a 5-kilometer race. That winter I took the graduate record examination and was accepted to graduate school, fully funded, the following spring. I graduated with a master's degree 2 years later, then had a baby, and now I have a good job and a stable life. I believe the injury and the stress contributed to a later diagnosis of rheumatoid arthritis. It was very stressful to have an untreated, incorrectly healed bone while trying to work and exercise in severe pain and being gaslit by doctors. I could not sleep properly for years, and I did not have enough money for basic needs because I was disabled by pain. Rheumatoid arthritis is often triggered by a severe injury or a stressful life event. That is my story about what it is like to not have health insurance and to be so broken down by a mismanaged health issue that your own doctors start stigmatizing you, calling you crazy, and discouraging your ambitions. I think if I had lived in a European country, things would have been better. I would not have gone 6 years without any health insurance. After the first botched surgery, I could have seen another surgeon to fix it, and I might have received assistance or disability support and better job protection. Thank you for the support. It was cathartic to tell my story. I do not blame my doctors. I believe they had good intentions but were limited by my lack of insurance, the type of doctors I was seeing, and the inability to see a podiatrist while I was on charity care. Story 5. My wife has 8 ruptured discs in her lumbar spine, from the first sacral vertebra to the 12th thoracic vertebra, according to the latest magnetic resonance imaging. The insurance company requires her to try physical therapy to see if it relieves her back pain before it will consider paying for surgery. I am living with a torn tendon and stretched ligaments in my ankle that probably need surgery. I have not been able to afford surgery for the last 20 years, so I often hurt when I walk and frequently roll that ankle. Story 6. I went to several doctors because of abdominal pain, but they dismissed it as my period. This continued for several months. I ended up going to the hospital because the pain became severe. They found white blood cells in my urine, so they assumed I had a urinary tract infection, but another nurse decided to do an ultrasound just in case it was appendicitis. It turned out I had a grape-sized tumor, and having lost my dad to cancer only a few months earlier, I was not in a good headspace. They took me back to my room. My original nurse walked in, saw me crying, and in a very agitated tone said, "It's just a urinary tract infection. No need to cry over it." Story 7. My personal experience. I had a 104-degree fever for 3 days in the hospital and received minimal care. When I told admissions I did not have insurance, staff treated me as if I had the plague and I spent most of my time alone in a room. They put me on intravenous fluids, gave no medication, and only ran a test that suggested I might have strep. When I was finally released, I received a bill for about $10,000. My mother's case was worse. In January 2014, she saw a doctor for persistent vomiting. Tests were inconclusive and she was sent home. By June, she had not been able to eat solid food since December. After repeated visits and being told she was fine, she died at the end of June. A doctor we had insisted on consulting confirmed she had brain cancer that had essentially shut down her stomach. Her death was tragic, but the worst part was the $750,000 medical bill my father received. Insurance covered only $30,000 because many services, including the room, most tests, and the oncology unit, were not covered by his plan. Story 8-1. My wife spent 6 days in a hospital, 4 of them with no diagnosis until a third doctor examined her and determined that her gallbladder needed to be removed. Thankfully, we had good insurance and everything turned out fine. 2. An ambulance ride for me cost $1,494 and lasted only 12 minutes. 3. An emergency room doctor misdiagnosed our daughter as being allergic to my wife's breast milk and called my wife crazy and a danger to her newborn child. Thankfully, a pediatrician challenged him. Story 9. The dermatologist was also a plastic surgeon and emphasized that background. When I said I was itchy all over, he told me to air dry after a shower and sent me on my way. 3 months later, after he failed to return my calls and was booked weeks in advance, he finally asked if we had taken a skin scraping at the previous visit. I said no, we had not. Turned out I had scabies. He apologized, but I was very upset and complained to my primary care physician, so she would not recommend him in the future. Story 10. A patient at an office where I used to work needed a computed tomography scan of her abdomen. The medical doctor saw something on an X-ray that worried him about cancer. The insurance company denied the computed tomography scan because it could impact the patient's reproductive health to have 2 scans in succession. The patient was a 65-year-old woman. That same insurance company had paid for her hysterectomy. What reproductive health were they protecting exactly? After a short and very rude phone call, they agreed to cover the scan. She did have cancer and would have died within a year had it not been detected. Story 11. I do not know if I would count that, but I was having my first panic attack and truly thought I was dying. I would have chosen death rather than call an ambulance and pay for it. Thank God I did not die, but it is sad that this is what you think in that moment. Story 12. How about signing up for the Affordable Care Act yesterday? A $7,500 deductible. a $2,430 premium every month. Story 13. I am not American, but we were on vacation in Florida in the 1990s when my little brother developed an ear infection and we went to the hospital. I remember my father being angry about the bill because they charged him $8 per cotton swab. A few years ago, my mother developed a bladder infection in Florida, and the visit cost her $3,800. Coming from Canada, this is unheard of. My father recently had a prostatectomy for cancer and experienced major complications after surgery. All we paid was daily parking to visit him. Story 14. I have a recent experience. My partner has a weird pain in his lower abdomen and does not have insurance. I called about 20 doctors in my area and none of them will see you if you are self-pay. There was one who only made an exception to see him because I was referred by my gynecology office. But when I asked how much a visit would cost, they said they could not tell us until after the visit. He will have to fly back to Italy just to find out if something is wrong. Story 15. Last year, I accidentally swallowed a soda tab that was floating in my drink and went to the emergency room. The radiology technicians did not speak to me. They spoke about me and laughed, saying I was the oldest person they had seen with a swallowing mishap. One of them asked if they were exposing me to too much radiation, and the other replied that it was probably fine. They found nothing and charged me $3,000 for the x-rays. This week I broke my toe, and my partner had to drag me to the emergency room because I did not want to go through that again. I cried the whole time they took the x-rays because I have no idea how I will pay for the visit with the holidays coming up. Story 16. I am a female veteran and have two striking examples. I receive coverage through Veterans Affairs. As many people know, veterans are a sad bunch. 2021 was a horrifically bad year for me. My second mother died. I had custody of my teenage brother. I was 30. My boyfriend was constantly losing his mind on me, all while working 40 hours a week and preparing to move to another state. Trying to be proactive, I tried to set up an appointment for mental health. The 10-minute intake took 2 months, and then I never heard back. At that point, I was actively trying not to kill myself, which I conveyed. I was simultaneously dealing with a gynecological issue starting in January 2021. I would not stop bleeding for weeks on end, 2 to 3 weeks a month. I was trying to get in for a consult. I was told I was miscarrying and to go home, despite being sexually inactive. This went on for about 3 months until I finally snapped at a desk worker and shouted about bleeding out in front of everyone. I was then put on a list for a consult in a week. They did the scans and said nothing. At that point, I had basically a 1.5-hour window where I could leave the house and that was it. I finally went to the emergency room at 3 in the morning and explained the situation. A female doctor was furious that there was not even an option to request a gynecological consult. She gave me a very low dose of birth control to try to stop the bleeding. It helped a little. In August, I made the normally 10-hour drive to move. It took much longer because of my condition. I signed up at the local clinic where they had to do blood work as part of the intake. They repeated it 5 times over the span of 2 weeks because the tests must be wonky. I got a voicemail very early in the morning telling me to go to the closest emergency room for a blood infusion because either I had blood cancer or I literally had no blood. I was 10 hours away from anyone I knew except my boyfriend, and they left that message on voicemail. All the while I was trying to get set up for mental health again because I was sleeping 1 to 3 hours a night inconsistently. My eyes felt like they were melting out of my skull and I wanted to blow my face off. Mental health scheduled 3 different appointments and canceled all of them. On the 4th reschedule, I lost my mind and told them they were the reason so many people kill themselves. So I said forget mental health for now. Back to the blood. Apparently I had a grapefruit-sized fibroid or cyst in my uterus that was not passing. I found this out 2 months after my move when a different provider casually called me the Walking Dead and told me that my blood was like molasses because my body could not keep up with how much I was losing. I had lost about 50% of my hair density, which I had attributed to stress. He informed me that if I did not get this in check, I would be dead by December. Meaning that if I had never moved, my brother might have woken up to my dead body one morning. What was their solution? There was really nothing because no surgeon would sign off on surgery while my blood volume was so low. I continued taking the minimal amount of birth control, and eventually I did not die. I still have the mass in my uterus, and it has stayed within a functioning range since the start of 2022 after I weaned off the birth control. I found a lovely older male therapist that I still check in with when I need. If it had been left up to my original provider and without self-advocacy, I would be dead. Story 17. I have a terrible insurance company. Let us call them Kaiser Permanente. I am under 25, so I have insurance through my mother in another state. The carryover between the departments in the two states is reprehensible. A website glitch has left me unable to access my coverage. I was on customer service lines for 8 straight days before finally reaching the escalations department. When I listed the litany of hoops I had to jump through and explained that while the website was broken, I would be unable to access my medications, medical records, or appointments, the representative expressed sympathy and said they did not expect the issue to be resolved until 2026. I hung up and cried. A big screw you to Kaiser Permanente. Story 18. I had half of my upper lip mostly chewed off by a dog when I was 10. My parents could not take me to a hospital because my father was between jobs and we had no insurance. Fortunately, my mother had been a doctor's assistant and was able to treat me herself. I had a large, visible scar on my lip for years, and even now that spot droops about 1/4 of an inch when I relax my face. Story 19. I have been incredibly lucky health-wise, so mine is extremely tame, but it still shows an issue. I was prescribed a medicine I did not need, but that still could have been very helpful. A month's dosage cost $1,500. My wife and I decided that if the medication was covered after I reached my $3,000 deductible, we should get it. I called the insurance company to check. They said yes, after I reached my deductible it would be covered. I called the pharmacy and they said it was not covered. I reminded them that the insurance company had said it would be covered after the deductible. I called the insurance company again. In a lengthy conversation, they gave multiple contradictory answers. Yes, it is covered. Yes, after the deductible is met. No, it is not covered at all. It is not covered, but there is a cheaper generic, which there is not. Yes, and there are cost-saving options. Eventually, a supervisor said it was covered, but when I asked for that in writing, they suddenly changed the answer. I am not going to criticize anyone just doing their job, especially when they have to deal with angry people, but for crying out loud, they need to learn to listen and not just read their script. Story 20. During the coronavirus disease 2019 pandemic, I was hospitalized for 8 days for a non-coronavirus-related condition. I had to take medication for months, I was unemployed, and I had no insurance. Fortunately, I live in Massachusetts, so the Mass Health program paid for everything. I did not pay a dime. But remember, universal health care is bad. Story 21. This happened to my wife. She had a gardening accident involving a bush and a hoe and ended up with a pretty gnarly cut on her ankle. She felt fine until about 11 p.m. when the pain made her want to go to the urgent care center. We went there and waited for hours with no treatment. The attending doctor, in consultation with the emergency room doctor, said he was worried a piece of the bush might still be in her ankle and advised us to go to the emergency room for imaging and further care. We went to the emergency room and waited again late at night. My wife was seen and told the injury was not severe enough for imaging or further care, so we were sent home. Later, we received an emergency room bill for about $3,000. 3 weeks later, she was still having pain. The primary care physician used pliers and pulled a half-inch-long piece of wood from her ankle. We disputed the emergency room bill, but were told the care provided was appropriate. We are still paying it off. Story 22. I was in the hospital with coronavirus disease 2019 in 2021. One of the nurses became very angry when I asked her to use a smaller blood draw needle because my veins kept collapsing. She hurled my bedside table across the room, scattering my dinner tray. An open can of soda struck me and I began to cry. She had frightened me, and I told her to get the hell out of my room. 3 days later, my intravenous line came loose and leaked all over me, which loosened the heart monitor pads on my chest. The alarm sounded and another nurse came in yelling and accusing me of tampering with the intravenous line, which I had not done. I could not wait to leave that hospital. They discharged me with a fever and I was barely able to walk. Story 23. My elderly mother tripped, fell down the stairs, and cracked her skull. We rushed to the emergency room with a blood-soaked bath towel wrapped around her head. We sat there for 2 hours while she went in and out of consciousness. She became angry and tried to walk out but collapsed unconscious on the sidewalk. By that point, we were using a second towel. The staff cited liability and refused to help. I called 911 for an ambulance, but they said they could not assist because we were already on hospital property. I had to drag her across the street off hospital property before the ambulance crew loaded her, drove her back across the street, and she was admitted. This was nearly 3 hours after she had cracked her skull. Story 24. It's just so complicated. I had an incident with my foot that required stitches while I was out of state. I went to the emergency room. One visit required me to pay 3 different entities: the radiology department for the X-ray, the emergency room, and the health system. 3 different entities have been calling me about payment and could potentially send me to collections. I paid them all weeks ago using my health savings account, but I am still getting daily calls because, for whatever reason, the payments have not been processed. Even though I already paid the bill, I still have to stay on top of it and explain the situation when they call because they do not care and will send you to collections over something you have already paid for. Story 25. I was sick. I couldn't keep any food or drink down, and I lost over 30 pounds in 6 weeks. I recently moved and couldn't get into a new primary care provider quickly, so I went to urgent care. A nurse practitioner first accused me of being an alcoholic, despite the fact that I hadn't had a drink in months, then refused to order the ultrasound I requested, give me any referrals, or consider other options. She said I had to find a primary care provider, schedule a new patient appointment, get a referral to a specialist, and then they might order the ultrasound. So I did. Every time I scheduled an appointment, I said it was to get an order for an ultrasound of my gallbladder. Took another 2 months, but I finally got the ultrasound. A couple of days later, I had emergency surgery to have my gallbladder removed. The crazy part is that I had been unable to wear pants for 4 years before this because the waistband was too painful. Countless doctors had convinced me that was my life and that I just had to live with it for 4 years. I had been asking if it could be my gallbladder for a long time. Story 26. I had a mysterious pain in my uterine area. I drove myself to the wrong hospital, where I collapsed and was taken by ambulance to the nearest emergency room, half a mile away. The emergency room nurse kept telling me to take fentanyl. Even in my mind-numbing pain, I refused opioids, but she kept insisting. The doctor eventually gave me a non-opioid pain medication. I was in the emergency room for about 5 hours, and they could not determine the cause. I eventually felt well enough to go home. I was sent a bill for $15,000 for the ambulance ride, $35,000 for the emergency room visit, and $10,000 for the emergency room doctor visit. Even though I had just become unemployed, I did not qualify for assistance because I had income earlier in the year. I let the bills go to collections and paid a lump sum of $5,000 for everything, which I paid off over a long time in increments of a few $100s. Even after 6 years, I still receive contacts saying I owe small amounts here and there. I do not respond. Story 27. I have many stories, but the most recent one that makes me seethe is about my mum. My mum has been on anti-seizure medication for over 10 years. One of the downsides is it makes her bones brittle. Her doctor prescribed a Prolia injection to help. The injection is given every 6 months as part of a sequence. Health insurance approved only the first injection. A medication that must be given every 6 months was considered necessary only for the first dose. That is not how the medication works. If they approve the treatment, they should approve the whole sequence. Even the doctor was yelling at them on the phone. As she approached the 6-month mark, my mum said she would pay out of pocket until it could be sorted. The clinic where she received the injection would not give a second dose even if she paid, because the insurer deemed it medically unnecessary. I thought she was going to strangle a nurse. After many calls and fights, we finally got them to cover the second injection, which held her over until she could go on Medicare. Now there is no problem ordering the shots. If I tried to tell someone what medications they can and cannot take, I would be arrested for practicing medicine without a license, but insurance companies do it all the time. Story 28. I had been seeing a retina specialist annually for diabetes-related eye exams. The standard treatment for my condition is in-office laser surgery. It is inexpensive and carries very little risk. Instead of performing the standard treatment, the doctor did nothing for 10 years, waiting for the disease to progress until an in-hospital procedure was required. That procedure is highly risky and nets the doctor approximately $1 million. The doctor I was seeing owns a large chain of specialty clinics, so the money goes to him. The procedure failed and left me blind in one eye and in severe, untreatable pain. It turns out he is known for this scheme and for having an unacceptable surgical failure rate. He has been withholding treatment to perform a risky procedure he is not skilled enough to perform, and he profits directly. Our healthcare system is dangerous and corrupt. Data about situations like this does not even exist, but it most certainly happens often and harms or kills many patients. Story 29. I used to be a bud tender in Detroit, assisting with growing and providing marijuana to medical cannabis patients. I worked there for a year and a half, and there were more than 10 people with terminal illnesses who could not afford medical treatment and did not want to leave their families in debt, so they relied on marijuana until they died. It was heartbreaking. Story 30. I am living with this. I have degenerative discs and diabetes. The doctors are ignoring the obvious problem. I am in extreme back pain constantly. They have told me it is neuropathy, yet you can see the misshapen contour of my back without an X-ray. It is extremely obvious without a shirt on. They have also tried to blame it on my cannabis use. They have tried to force every type of antidepressant and mood stabilizer on me because I seem agitated. I am agitated because I am in constant pain. The doctors will not address my obvious back problem. There are numerous X-rays and magnetic resonance imaging scans that confirm it. A spine specialist told me there was nothing they could do for me. They pretend it does not exist and follow a script they cannot deviate from. Pain management told me to take Advil and stretch, which I have been doing since my first back injury at 14. I am now 55. I grew up in Europe and have lived in the United States since I was a teen. My father was in the United States Army, so I also experienced Department of Defense hospitals. The American healthcare system is inadequate. Even the Army seemed better at it than these healthcare organizations. Story 31. I suffered through the last 2 kidney stones and paid $2,000 after insurance, only to be told it is a kidney stone and to come back if it does not pass in a month. Story 32. I had a couple of surgeries for different issues one summer. The first was on July 18th, and the second followed an accident. I had an appointment on August 20th, and the surgery was scheduled for the morning of August 21st. Both surgeries required preoperative physical examinations. I had obtained one for the first surgery on July 11th. Everything checked out, but it was more than 30 days before the August 21st surgery, so it did not count. I had to get another preoperative examination within 24 hours or the surgery would be canceled. There are 2 major healthcare groups in the city where I live. Not a single clinic in either system could see me for a preoperative examination within the next 2 weeks. I had to call in a favor from my brother-in-law, who is a doctor. He was moving to a town an hour away and had accepted a job at a new clinic but had not started yet. He called and the clinic scheduled me with another doctor for the following morning, which was 2 hours before my scheduled surgery. It all worked out, but I spent more than 3 hours on the phone calling clinics and urgent care centers that kept turning me down. I was fortunate that my brother-in-law was able to help. Story 33. A series of misfortunes led me to use Medicaid. I live in X County, which has one hospital for about 280,000 people. The hospital also serves Y and Z counties, adding about 100,000 more people. For people using Medicaid, only one insurance provider is in network for this hospital, United Healthcare. I found out yesterday that United Healthcare's negotiations with the hospital have fallen through, and only emergency medical care will be covered. This means that if someone uses Medicaid and chooses United Healthcare on the off chance they will need a hospital service, it will no longer be paid for. Having a heart attack. Yes, go to the emergency room. If you need a bed or treatment in any other department after that, you will be out of luck. This applies to all providers associated with the hospital who are in private practice, such as respiratory therapists, oncologists, and cardiologists. At 60 years old, I have not yet had my worst healthcare scenario, but it will happen. I will need hospitalization eventually, and I will not get it. Story 34. I was 14 and had just been discharged from the hospital after an asthma attack. I had been there for a week. I went to the hospital pharmacy to pick up my steroid inhaler, which prevents the airways from swelling and was very necessary after the attack. When I arrived, they told me my usual $12 inhaler would cost $500 because my insurance had stopped covering it. This happened after President Trump signed an executive order that allowed insurers to stop covering pre-existing conditions. My family was very poor at the time and we could not afford $500 out of pocket, but without the inhaler I would have slowly asphyxiated. After 3 hours, the pharmacist reached my insurer and convinced them to cover it, but crying in that pharmacy because I could not afford my medication was one of the most dehumanizing experiences of my life. I still call my co-payment the breathing tax because that is essentially what it is. Story 35. My father underwent surgery. A surgeon left a rod inside him that was not supposed to be there. The surgeon confirmed it had been left by accident and said it should be fine, then left to go to Europe for a month. After about a week of severe pain, my father returned to the hospital. Other doctors said it needed to be removed immediately. He suffered permanent nerve damage as a result. The original surgeon is now dead, and I hope he is in a warm place. Story 36. Long story. My gallbladder completely failed within 2 months after a car accident. I had many other injuries. The first doctor I saw after the accident said I was healing and ordered an ultrasound because I complained of pain that could be my gallbladder or pancreas. The ultrasound radiologist noted the gallbladder showed little activity, but the doctor still said I was healing. A physician who made house calls examined me and, based on my symptoms, said the gallbladder was not functioning. She told me to insist it was my gallbladder during a scheduled second opinion. That second opinion doctor did not believe me and sent me away. The physician who believed me referred me to a specialist she recommended. He initially took me seriously but then scheduled a hepatobiliary immunodiacetic acid scan for a month later. A friend who is also a doctor demanded an earlier scan. The hepatobiliary immunodiacetic acid scan showed my gallbladder had only 2% functionality. I was told I had at most a couple of weeks to live. I had emergency surgery the next day. Neither the car insurance nor my health insurance covered the surgery or medical bills. I had to sue, which took almost 4 years to get them paid. The car insurance arranged an independent medical examination and concluded I was fine despite the other doctor's findings. My health insurance denied coverage because the injuries were related to a car accident. Story 37. A few years ago, a family member of mine had serious mental health issues and needed to see a therapist. I contacted their insurance provider, which said it maintained a long list of approved therapists. I went through the list and called each option. Some of the phone numbers were no longer in service, some said they did not accept the insurance provider that listed them, and some were not mental health therapists but physical therapists. The first 20 people I called either could not or would not provide therapy for my family member. I remember thinking, fuck, now I am depressed just trying to find someone who will help. I have put off my own therapy for the same reason. Story 38. After my 93-year-old mother had a magnetic resonance imaging scan for dizziness, the primary care physician said the tumor he saw probably was not the cause. We then saw a neurologist who compared it to the magnetic resonance imaging from 2 years earlier and said it had not grown. Siblings have been very involved in doctor's appointments, and no one mentioned a tumor 2 years ago. That is not something we would have forgotten. Story 39. I had kidney stones in my mid-20s. Despite appropriate scans and hematuria showing a need for surgery, I was sent home after each emergency department visit, sometimes with medication and sometimes without. After about 3 years of that pattern, I collapsed at work and went to a different hospital that accessed imaging from a previous emergency department visit. They determined I needed immediate surgery. I had over $100,000 in medical bills after that surgery and had to declare bankruptcy. Fuck the American healthcare system. Story 40. I am 20 years old. I decided to get a hormonal intrauterine device. I went to a gynecologist, I had never even had a pap smear at that point. She performed the exam and told me that my cervix, where the intrauterine device sits, was tilted, so she would use a clamp to straighten it for insertion. I was lying on the examination table with my legs in stirrups, the speculum was in place, and she used a clamp to tilt the cervix and insert the intrauterine device. It was excruciatingly painful. The worst part was that she said, "The clamp is stuck on your cervix." I have never had that happen before. After she removed the clamp, I got dressed and then passed out in the lobby of Planned Parenthood. Months later, I became very depressed. I am not sure whether it was related to the intrauterine device, but it seems suspicious to me. Insertion of an intrauterine device without pain medication should be illegal. Story 41. My child was sick, so we went to the urgent care clinic. They said he had appendicitis and needed to go to the emergency room. We followed instructions. The emergency room admitted him and waited 3 days before deciding to remove his appendix. Insurance declined to cover the procedure because it could have been done on an outpatient basis. The bill was $40,000. Story 42. So I have idiopathic intracranial hypertension, a cerebrospinal fluid brain condition. I have a stent in my head. It caused nerve damage and left me in a never-ending migraine. I am on a large cocktail of medications to make me semi-functional. I can be pain-free only if I isolate and do nothing. One day I went to refill my medications and one of my most important medicines, Nurtec, was canceled. The insurance company decided I should try an injectable without informing me. My neurologist had to write a new prescription which was initially denied. I had to find a specialty pharmacy to fill and ship it. The injectable did not work. My headaches are severe, worse than migraines. The first month with 2 injections helped, but after a week the effect wore off and the migraines returned. My neurologist wrote a new prescription for Nurtec, and the insurance company caused more delays. I spent a few months essentially catatonic because the insurance company insisted on their preferred treatment. Story 43. My story is very tame in comparison but different, so I thought I would share. We had United Healthcare. This was when my second child was born. We had a $3,500 deductible, 20% coinsurance, and a $7,500 out-of-pocket maximum for the year. Our daughter was born, we paid the bills, and everything was fine. One thing to understand is that when a child is born, you do not pay one bill of $3,500. You receive many small bills that add up. They kept coming and tallied up on our account. $100 for a doctor visit, $35 for a nursing fee, and so on. There are so many rules about what is covered and what is not. The hospital can be a network, but the nursing agency that supplies the nurses can be out of network. It was a clown show. I ended up paying about $8,000. A week before my daughter's birthday, an unassuming letter arrived in the mail. United Healthcare sends a lot of mail, and most of it is privacy policy updates or junk, so I opened the letter. It contained a $5,000 check for having overpaid almost 8 years earlier. They said they had discovered the discrepancy during an audit. I was furious. First, had they not done the audit, I would have had no way of knowing I was overpaying. It was too complicated. Second, there was no notification on my online account that a refund was coming. Third, if I had owed them $5,000 for 8 years, I guarantee there would have been bill collectors, wage garnishment, legal actions, the works. But because I overpaid, I am certain they only returned the money because an auditor made them. Story 44. This is pretty low-key compared with some other people's stories. When I gave birth to my son, the insurance covered the hospital, but one of the doctors we saw and the anesthesiologist were not in network, so we had to pay extra for them. When my son was 6 months old, he contracted respiratory syncytial virus and was so sick that he needed to be put on oxygen. We took him to urgent care several times over several days and ended up at his pediatrician's office, where they called an ambulance so he could be put on oxygen immediately. It was that serious. The insurance company said the ambulance was out of network and would not pay for the 2-mile trip. The charge was $900. The deductible resets every year regardless of how much you have already spent. My son was born in December, and in January I had a postpartum hemorrhage. We paid $2,700 toward the birth, which did not meet our deductible. Because a new year had started, our coverage reset and we had to pay another $3,000 for the emergency room visit and the dilation and curettage procedure to stop the hemorrhaging. Fun. Story 45. Answering the same question repeatedly did significant damage to my mental health. Story 46. Not bad compared to most, but I want to quit my job. I have been at the company 10 years, and new leadership took over. I am miserable. My husband works for a small company that does not offer health insurance. We have a 1.5-year-old and I am pregnant. He wants me to quit and I want to quit, but I am staying because of health insurance. I am staying at a job I hate that causes high stress because I do not know what we would do without my health insurance. With insurance, my last labor and delivery cost about $7,000. I do not know what it would cost without insurance. From what people say, private health insurance costs much more and provides much less coverage. I should not be held prisoner just for health insurance. Story 47. Every time I break a bone or cut part of my finger, they tell me to take a lot of ibuprofen. Story 48. The time my husband called 911 because I was bleeding profusely, and they did not answer. Story 49. I make too much money to qualify for government-sponsored health insurance, but not enough to afford coverage. I am in the process of being evaluated for 2, possibly 3 disabilities, but I cannot see doctors unless I pay thousands out of pocket. Story 50. I had been having severe pains in the middle of the night for about 6 to 8 months, but they would go away quickly. I did not have a primary care physician at the time, so I never had it evaluated. One night, I was woken from a deep sleep. The pain was so intense I was struggling to breathe and could barely walk. When it did not go away for more than 2 hours, I agreed to go to the emergency room. I was barely examined, and a male nurse dismissed it as girl problems and would not let me speak. Defeated, I was sent home and the pain eventually subsided. About a month later it happened again, worse. I tried to endure it, but it kept getting worse. I tracked anything that might affect it, especially food, but I could not find a connection. This time it started more in my lower abdomen and I worried my intrauterine device had an issue. After hours of agony, I was convinced to return to the emergency room. My blood pressure was high, and the intake nurse told me to calm down when I was trying to be as polite and calm as possible. By the time I was taken to a room, the pain had subsided, and another male nurse said that since the pain stopped, I could go home. It was probably just gas. Get some over-the-counter gas medicine on the way home. I tried to say this was not gas, but I was told that sometimes gas can hurt and was dismissed. A month or 2 later it returned, this time in the early morning. I could not walk without being hunched over and could pinpoint it like a vice grip just under my ribcage. It also came with intense nausea. I called out of work and my partner took me back to the emergency room for the 3rd time. The nursing staff seemed disinterested. When they finally gave me pain medication, I said it did not touch the pain. After a 2nd dose, the pain decreased enough to rest, but it returned less than an hour later. I could not get anyone to listen about my tracking, and when one scan came back clear, I was sent home again with gas or girl problems as the explanation. Another month or 2 passed and I felt hopeless. Then I experienced probably the worst pain I have ever felt, 100 out of 10. Within 5 minutes I went from fine to struggling to breathe, my arms tingling, drenched in sweat despite the cold, doubled over and barely able to speak. My partner drove me to the emergency room. I thought I was having a heart attack because the pain extended into my chest, with sweating and tingling. I was quickly taken for an electrocardiogram that was normal. Back in a room, I received pain management and finally a nurse listened when I described my tracking. She asked why no one had given me an ultrasound. An ultrasound and a hepatobiliary immunodiacetic acid scan confirmed my gallbladder was inflamed and full of stones, and I needed surgery. I had my gallbladder surgically removed. The surgeon told me I had a critical level of gallstones and that it was only a matter of time before they caused a life-threatening rupture. Months later, I received a notice from my insurance company that I owed thousands of dollars for the surgery because it was not considered medically necessary, despite my surgeon stating it was absolutely necessary. Story 51. Do you mean what is our worst healthcare story so far? Because when Donnie is done, we will be looking back on our salad years here. Story 52. I had 3 epidurals with my last child. All failed, were painful, and caused intermittent pain. Ironically, they billed my insurance for the failed procedures. I am still fighting this 2 years later. Story 53. During the coronavirus disease 2019 lockdown, I was having trouble breathing. A telehealth provider said it could be treated with an inhaler, so I picked one up at the pharmacy. I went for testing the next day and learned it was a blood clot in my lung. Could have been fatal. I am on a blood thinner for the rest of my life. Story 54. This May, I went to the emergency room because I could not swallow or keep down fluids. They thought I had a tonsil abscess. When they did my blood work, they found that my hemoglobin and platelets were both dangerously low and required transfusions. I was diagnosed with leukemia with about 30% blasts at the time and needed to go to the cancer hospital immediately to start treatment. Because I was receiving transfusions, I could not transport myself, so they called an ambulance to take me 10 minutes from the emergency room to the cancer hospital. 2 weeks later, while I was still in the hospital, my insurance informed me that I owed $800 for that ambulance ride because it was out of network. Apparently, I was supposed to shop around for the correct ambulance while being transfused and being told I have a disease with a 5-year survival rate of about 30%. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.